Hi everyone, my name is Asma bin Abacha and I'm happy to present today the MEDIQA-EVAL shared task on evaluation metrics for medical multimodal question answering, a joint work with Wen-wai and myself. To measure is to know. This quote is especially important in the era of AI agents and models. However, how we measure is also important. Comparing hundreds of runs from different teams on the same tasks is a high-value experiment that can lead to new and more reliable insights. And this is exactly what shared tasks enable through standardized benchmarks, metrics, and controlled evaluation environments. In the medical NLP and AI domains, we have been organizing multiple shared tasks in the past 10 years, such as the MEDIQA Challenge series. This year, we're organizing 2 competitions with CLEF and 2 competitions at the Clinical NLP workshop. I will present the first MEDIQA-EVAL task, and George will present the MEDIQA-SIGNOR task. On this website, you will find more details about the tasks, datasets, and relevant links. MEDIQA-EVAL focuses on evaluating metrics for medical multimodal question answering. We evaluate AI-generated responses to patient questions paired with clinical images across several key dimensions, including completeness, factual accuracy, relevance, writing style, and overall quality. The main objective is to develop evaluation metrics that closely align with clinician judgments, enabling more reliable and clinically grounded assessment of AI-generated medical responses. To design the task, we followed a 4-stage pipeline. In stage 1, we provide the multimodal dataset with real patients' questions and images, system-generated answers, and references written by clinicians. In stage 2, participants submit metric scores computed over the provided system-generated answers. Stage 3 evaluates metrics by measuring correlation between metric scores and clinician quality ratings. Stage 4 ranks submitted metrics on a leaderboard based on their alignment with clinician judgments. We built on top of our medical question answering and VQA datasets, such as Derma VQA and Wound Care VQA, centered on dermatology, a visually grounded medical specialty in which clinical assessment heavily depends on images. Each instance consists of a patient question paired with corresponding medical images and clinician-provided references in English and Chinese. We then further augmented these datasets with system-generated answers from multimodal question answering systems and associated expert quality ratings, and built MORCA, the first benchmark for multimodal clinical question answering evaluation that enables direct evaluation of automatic metrics by measuring their alignment with clinician judgments. We evaluate metric quality across several dimensions, such as factual accuracy, completeness, relevance, and writing style. Higher Pearson, Spearman, and Kundal correlations indicate better alignment with clinician judgment and greater metric reliability. We built a baseline solution based on LLM-as-a-judge framework. The first variant includes a single judge, and we created 2 multi-judge variants by changing the temperature in the first one and using different personas in the second ensemble variant. Prompts and more details about the methods are available in the overview paper. The shared task attracted 48 registered teams and 5 finalist teams, submitted system outputs as well as their papers and code for verification. Most of them participated in both subtasks, English and Chinese. For the English dataset, the SUAT BMI team achieved the best average score of 0.48. Our single LLM-as-a-judge achieved 0.45. On the Chinese dataset, the MED-aware team achieved the highest score of 0.29, which is slightly lower than our single-judge LLM baseline, which achieved 0.33. An important finding is that LLM-as-a-judge methods aligned more closely with human judgment than traditional NLG metrics in the English dataset. For example, our MEDIQA LLM-as-a-judge baseline showed the highest agreement with human ratings, outperforming Rouge, BERT score, and BLERT. The overview paper contains more results for each evaluation dimension on the English dataset and the Chinese datasets. I won't present them because of time constraints. Teams' approaches were very different. The first team combined few-shot LLM judging, PubMed BERT classifiers, and RAG with clinical guidelines. They also used different components for style, relevance, factuality, and completeness scoring. The second team built a retrieval-grounded evaluation pipeline using GPT-5 Mini with curated medical evidence and combined visual encoders, semantic alignment, and Qwen-based reasoning. MED-aware used Qwen 3VL fine-tuning and reinforcement learning for joint prediction of all evaluation metrics. The BTI team proposed an agent-based React framework with GPT-4o, integrating multimodal retrieval, VQA references, and optional image augmentation. The fifth team applied an LLM-as-a-judge pipeline using GPT-4o and OpenAI evals with rubric-guided prompting. This is the schedule for the participants' presentations and their papers. In conclusion, results showed that LLM-as-a-judge is very competitive. Best performance comes from combining LLM reasoning with fine-tuned, metric-specific classifiers. Evidence grounding, RAG, and reinforcement learning improve agreement with expert ratings. Our recommendations start with a structured, rubric-aligned single LLM-as-a-judge, add clinical guidelines or case-based retrieval before adding model complexity, and prioritize stability across data sets and languages with consistent per-metric performance. Currently, we're working on extending the MORCA benchmark with more references and ratings for more stable results and better insights. If you're interested, we also extended the benchmark with additional annotations based on response content units, paper published at ACL Jam 2026. For next year, we're working on new shared tasks such as radiology report summarization and tumor board summarization and prediction. Thank you for your attention, and please reach out if you have any questions.